Hi, I'm Sophie. I'm a student athlete here at McGill University, and in this 4-part series, we are going to look at the myths that surround sports science. Joining me is Christopher Labos.
Hello.
A cardiologist who loves analyzing scientific data, and Nick Tiller.
Hi, everybody.
An exercise physiologist who takes a close look at the sports science hype. This is The Body of Evidence Tackles Sports Science, Episode 2, Recovery. All right, hi guys. Today we're talking about one of my favorite topics in sports science, which is recovery. As an athlete, I see that people's recovery routines are highly variable. Some of my teammates take it very seriously and some of my teammates do not. I think I definitely fall in the middle. I like to stretch. I like to get a lot of sleep. I like to use my little massage gun. But there have been points where I am wondering if there's more that I can do for my recovery and if the things that I do are actually effective, or if it's all in my head and it just makes me feel nice after a hard workout.
There's no shame in feeling good about yourself, right? If you do something because you enjoy it, that's perfectly fine. Where it becomes problematic is when people start making scientific claims that are just unsupported by the evidence.
But before we look at the evidence, I spoke to my fellow runners, football players, and rugby athletes at McGill to know what they do to recover from sport.
We have a tradition in rugby that after games no, it's true. It's not it's well known. Like we usually go like to the bar with the other team, like have a beer, and we have a social with both of the teams. So I mean, I don't think it's not optimal recovery. After games, I do like a cycling session, or I just go biking like on a stationary bike, do some rowing, a bit really light intensity to flush out the soreness.
As soon as the game is done, regardless of the score, like whether we won or lost, we're all together in either in a huddle or lines, and we're stretching out to get rid of the lactic acid and things like that, which is like pivotal to, I think, the start of our recovery.
Do you use any at home rollers, Theraguns, lacrosse ball, anything?
Yeah, I use my Theragun quite often. I always use it for practice.
I have a Theragun, proud owner. I don't know how much it actually helps, but it feels really nice on a tired set of legs.
I would say stretching is an important part of my recovery, but it does depend on the week or where we're at the training cycle.
First of all, sleep is really, really important. I'm trying to get 9 hours of sleep, that's for sure.
Eat well, go to bed early, that's it. I don't believe in anything else.
There is a massive effort in our team to stretch, eat, sleep. Sleep's the biggest one.
How often do you take ice baths?
I'll say sometime twice a week, sometime once, sometime never.
I've been advised to only ice after practice and not on my recovery days, and to alternate between ice and heat.
Oh, the contrast tub?
Yeah.
I personally, I'm a huge advocate for ice baths. I found they've massively helped me. I've had a bunch of injuries in the past, like muscle ones, and my groin recently has been really sore. Go in an ice bath, 10 minutes. I mean, it's Baltic, but it's brilliant, and it makes a massive difference with your muscles and the days after.
Right now, we are staring at a group of girls from the soccer team who have just finished practice, who are waist deep in garbage buckets full of ice water. It's making their legs really cold. They're going to get out and their legs are going to feel really stiff. Hopefully, I'm guessing their intended goal is tomorrow when they show up for practice again, their legs are as fresh as can be for some more pounding on the field. Right. I think the biggest thing that I've been wondering about lately when it comes to recovery is if we're going to be trying to quantify it, what do you measure? What are we measuring when we're saying stretching makes me 10% more recovered than if I didn't stretch, and all these little numbers, when do they start to matter? If it's 1% increase in, again, what numbers are we talking about? But how do I know, as someone who is I'm 20, I just started reading literature and trying to understand how science is done and how I can make sense of all the data that's given to me. What metrics are we using to quantify recovery?
Smoke and mirrors.
Okay.
Well, I guess in the literature, you can look at data that is subjective and data that's objective. So the objective stuff would be the gold standard. So if you do a training session and it's very difficult and you wake up the next day and you have sore muscles, which anybody who's ever gone and done a hard workout, they'll know what that feels like.
Especially after the age of 40.
Exactly. You get it more and more often.
Everything hurts.
But then you can take for example, in a lab study, you can take a blood sample, you can look at measures like CK, which is creatine kinase, or LDH, which is lactate dehydrogenase. Now, both of these are markers of muscle breakdown. Okay, so you can actually take a blood sample and look very objectively at the state of the muscles, and you can determine if a particular recovery intervention is facilitating recovery of the muscle. But then you've got arguably the more important measure is the perception, the subjective responses, because this is what most people are going to be using on a day-to-day basis. Most people don't have access to sports science labs or clinics.
Right.
So this would be if your muscles
and whose fault is that, Nick? Whose fault is that?
That's my fault?
It sure ain't mine. I got to blame somebody. I can't take responsibility for anything.
But this would be if your muscles are tired, if they're sore, if they're stiff, right? So you can go and do some kind of performance measure, do your very, very tough workout and do the performance measure again and look at the drop off to see if there's some kind of drop off in muscle performance. And these are the things that most people will be using on a day-to-day basis. The problem with that is that perceptions can be contaminated by the placebo effect.
Yep.
So if you expect that something's going to work, if you believe that something's going to work, then there's a very powerful psychobiological effect whereby you will convince yourself that this thing has worked. And this is very beneficial, but it can get us into a bit of trouble as well.
Yeah.
Right. So my biggest question always, and now that I have Nick here, and what are the things that are going to be most beneficial for my recovery?
Lots and lots of money.
Okay.
Well, definitely having limitless resources will be beneficial to you, but the reality is most people do not have unlimited resources. So in terms of it's probably easier to look at the things that are not particularly effective.
Yeah.
And we can rule some of those things out, and we can talk afterwards about the actual ways that you can maximize recovery. So, for example, I think some of your friends and colleagues said that they were using ice baths after hard training. Now, ice baths have been used for a long, long time, decades in high performance sport. And it all relates back to this idea that if you have some kind of soreness or inflammation, if you apply an ice pack to it, if you have an injury, an injured knee, you apply some ice to it, and it's the idea that the ice can reduce the inflammation. So, of course, if you have sore muscles, the idea being that if you immerse yourself in cold water or even ice water, then it's going to reduce the inflammation. If you look at the controlled studies on this, there is evidence that it will reduce inflammation by some very, very small amount, not necessarily more than if you were to take an anti-inflammatory or if you were to just do a nice cool down, sit on a stationary bike for a little while. But actually, there's plenty of good research now in the last couple of years in, for example, the Journal of Physiology, which is a very well respected, revered science-based journal. And they found that actually applying cold water post-training actually inhibits recovery. It blunts the muscle protein synthesis, it blunts anabolic signaling, and these are the things that we generally need in order to help the muscles repair, to help the muscles recover. And cold water actually blunts those signaling pathways. If you were to do a heavy training session, particularly a resistance type session, you upregulate muscle protein synthesis. You want to make sure that you're getting enough protein in your diet to help you recover. So this is a nutrition-based recovery intervention. And cold water actually blunts muscle protein synthesis. So if you actually look at the net benefit, it's probably going to be negative overall. There's going to be a net disadvantage to regular ice bathing. So I'm just wondering how long it's going to be for the science to penetrate the application.
Yeah, I think ice baths are just so popular in the just general sense, like it's in the public consciousness, that it's going to be a very hard thing to dislodge because people are just so used to it, right? And you know, there are people who do ice baths as part of their cultural thing, like going for like, you know, these polar bear clubs that go, they're not doing it for any medical reason, they just enjoy it. It's a social activity for them. And so it's become part of our public consciousness, and we tend to self-justify a lot of the things we do. I will sort of be a nice apologist here for a little bit, because I have seen people really sort of really disregard the value of ice. There is still a value in applying ice to an injury, right? If you fall and you twist your ankle and you put ice on it, you will have less swelling, and that's important for being able to get your shoes on and off. So I do see people say ice is useless, and it is not useful for many of the things that people think it is useful for. But in terms of if you were to fall and hurt yourself and sprain your hand, whatever, putting ice on it is going to decrease swelling because it does decrease inflammation. It is useful during the acute phase of illness. It's just not going to be useful for long-term recovery, because after a few hours, I'd say even probably like an hour, it's probably no longer that useful to keep applying ice packs. But if you bonk yourself on the head and you don't want to get a bump on your head, putting an ice pack on there is going to keep that swelling down.
Right.
And a lot of people use ice baths or cold water because they just like the way that it feels.
Yeah.
It helps them to refresh. A lot of people start their day this way, and there's absolutely nothing wrong with that. There are some indications that it might not be particularly good from a sort of a cardiovascular perspective. Does it increase cardiovascular risk?
Very cold temperatures can be a bit of a quote-unquote shock to the system. So if you're not used to it and you get in there and you're going through a stress response and your heart rate shoots up and you have pre-existing heart disease, that's maybe not great. But I mean, again, and of course, hypothermia, that's still a thing, right? And like, especially people who are not used to it, who go out like, we're going to go into this polar bear club, and they're out there like, why do I feel numb? I'm like, oh God, I'm developing hypothermia. So hypothermia is definitely a risk. So they're not great, but they're not treating a disease, I don't think.
Okay, that's good to know that ice baths are detrimental to recovery.
Overall.
There's a lot of other recovery therapies that have to do with temperature. I've seen cryotherapy get a lot more popular in recent years. And does it have a similar effect on the body as an ice bath?
Yeah, so whole body cryotherapy is this. You've seen a lot of football players do it. Soccer players and American football players do it. It's very popular in basketball as well because they have the resources to have their own cryotherapy.
They have money to burn.
They have money to burn. And so this is when you basically get in a closet. It looks like a closet from the future, and it's filled with usually argon and nitrogen gas that's been cooled to very, very low temperatures, like minus 200 degrees Celsius. And you spend somewhere between 2 and 4 minutes in the thing. It's the same idea that being exposed to those cold temperatures can reduce the inflammation. It's been extensively studied, and actually it may possibly have a very, very small effect on inflammation, but it's certainly no more effective than any other way of suppressing inflammation. And here's the key thing is that for it to be in any way effective, you have to have multiple daily exposures on multiple consecutive days. So for most people, this is just not financially viable.
Right. And in Montreal, you could just go outside in the winter and be like, there you go. It's problem solved.
It's pretty much minus 200, I would say. That's what it feels like.
Close enough.
Sophie, have you ever tried ice bathing or cryotherapy yourself?
Have you experienced a Montreal winter, actually? First question.
I have experienced a Montreal winter. Wouldn't recommend. It's not my favorite.
Okay.
But I have ice bathed before. I did it a lot more when I was younger, when I was like...
During your misspent youth.
Exactly. You read my mind. And I'm a combined events athlete. And so I do heptathlons in the summer. And so you have 2 days of competition. You have day one and you have 4 events, and you get home and you're a zombie. And then you have to go to bed and get up for day 2 to finish the heptathlon and do 3 more events. And mainly when I would ice bath would be in between those 2 days. I actually really liked it in that context because my body just felt horrible, and I'm sure it was largely psychological, but it did feel nice to get into an ice bath and feel like, okay, like I'm a bit more awake, and now I'm gonna go to bed and hopefully tomorrow not like fall over my feet on the track. I know a lot more, like my teammates ice bath after hard sessions because there are some coaches that support it, but I have heard a lot more recently about contrast baths. So getting in an ice bath and then getting in a hot shower, or being in the shower and it's really cold and then it's really warm, and something about dilating and constricting your blood vessels. And is that more effective than taking an ice bath?
Okay, so the main premise behind this kind of contrast therapy is that and it's the same with most kind of recovery interventions, is that it's supposed to stimulate blood flow.
Right.
If you stimulate circulation, then in theory you're removing metabolic byproducts and waste products that are no good in the muscle, and you're helping to deliver fresh oxygen and nutrients and all this kind of thing to the muscle. Now, you can stimulate blood flow by doing pretty much anything, by just moving, by just walking around.
Or by stabbing yourself.
But you could probably do that. If somebody gives you a compliment and you start blushing, you're going to stimulate blood flow to the skin. So sure, and one of the benefits for actually sitting in an ice bath is not the fact that it's cold, but you're sitting in a body of water, and the hydrostatic pressure actually compresses the blood vessels to some minor amount, and it helps to stimulate blood flow in that way. So this is, for example, the premise behind compression garments. It's this idea that you put on these very, very tight garments. In Europe, skins are very, very popular. They're very, very expensive as well. And it uses this idea of graduated compression to help stimulate circulation. Now, there are two main claims for using compression garments. One of them is that it improves exercise performance. The other one is that it can promote recovery. There is a little bit of data showing that compression tights, if you wear full lower body or whole body compression tights, might actually facilitate recovery. So this kind of thing might be beneficial if, for example, you do a very, very hard training session, or you do a very tough race, and then you're going to, for example, be traveling back across country. So you're going to be sitting still for the next 6 or 8 hours. In that kind of scenario, it might be worthwhile actually wearing some kind of compression tights, because it's better than nothing. But in terms of the performance aspect, there's hardly any high quality research showing that wearing these types of garments will improve exercise capacity or performance.
There is one clinical situation in which we do use compression tights, stockings, pants a lot, and it's in patients who have heart failure to fight leg swelling. What heart failure essentially is you're accumulating water, and water accumulates in your feet because, gravity. If we could convince people to walk on their hands, we wouldn't have this issue. But because people walk upright, because they insist on bipedalism for some reason, all the water accumulates in your legs, and your legs swell. And you might think, well, who cares? It's actually a big deal for your legs to be swell. Your shoes don't fit. It can be very painful. And so the one thing, we obviously have medication, to treat heart failure, but the one device that does work is compression stockings. But the ones that work best are really those full length ones that go from your feet up your legs, basically to your hips.
Okay.
And they are extremely uncomfortable, and a lot of people don't like them. But you really do need this full compression in your legs for it to have any real benefit in terms of preventing leg swelling. In terms of improving circulation, that's not really what they are for. It really is all about hydrostatic pressure more than anything else. You're basically squeezing your legs. If you can imagine, I'm trying to think of a good analogy. There's water in your legs, and you're squeezing it so that it doesn't accumulate your legs and just redistributes to the rest of your body. So they can be used, but for them to have any real meaningful effect, they really do have to be these full length ones that are going to be very uncomfortable to wear for any extended period of time. If you're going to wear them for a short period of time, for 2 hours after your race, maybe, but for people who have to wear them on a daily basis, a lot of people are like, I just can't wear them. I can't do it, because they're so hard to wear, especially during the summer, because they get very, very hot. Yeah.
Okay, so compression, maybe.
Yeah, and I think one of the things just to look out for when you're looking at compression, either compression garments or compression devices, a lot of the time they will say that there's loads of research to support the intervention and to support the claims. And then when you go and look at the research, they'll direct you to studies looking at deep vein thrombosis or other kind of clinical interventions designed to mitigate the risk of that. And actually, they're selling you some kind of commercial compression sock that hasn't actually been studied.
Yeah.
So in this case, they are cherry picking clinical data to support their claim, and there's going to be a real mismatch there. So that's just one to look out for.
Okay, well, that's really good to know. Thank you for clarifying that. I personally don't wear compression socks or compression leggings, but something that I do for recovery almost every single day after a session is stretching. And it's probably, growing up, one of the most controversial recovery techniques. Some coaches discourage stretching always, no matter the context. Some coaches say, dynamic stretching, so you're not static, you're moving. And some say not before, only after a workout. Some say only before, not after a workout. And it's one of the most confusing topics to think about personally as an athlete, because everyone has their own opinion on it. And I'm curious what the science says about stretching.
So you alluded to two types of stretching, static and dynamic. So the difference, very briefly, between them, as you well know, is static stretching is when you put you lengthen a particular muscle. So you hold your instep and you stretch your thigh muscle, and then you hold it for a period of time, maybe 5, 10, 20 seconds. Dynamic stretching is when you take the muscles and joints through their normal range of motion, and it's an isotonic movement. Okay, so for example, you might do lunges in a certain position. You might do large steps. You might do half squats, something like that. So you're taking the muscles and joints through a normal range of motion to warm them up. Now, typically, dynamic stretching is encouraged before exercise because it's a good way to warm the muscles up. It can take between 10 and 20 minutes to actually get the muscles to an optimum temperature for performance. So actually doing a full comprehensive warm-up is really important for optimal performance, and dynamic stretching can be an important part of that. Now, in terms of static stretching, it really depends on the individual and the type of sport that you're doing, because on the one hand, having some kind of flexibility in the muscles and joints will be important for reducing injury risk in certain sports. The flip side of that is if you have very, very long muscles that are not very stiff, you need a certain amount of stiffness for strength and
joint stability.
And joint stability, and for things like sprinting, for power-based movements, you need muscles that can hold high tensile strength and that can return elastic energy. So you don't want to be overly flexible as a sprinter. So there's a balance there. If you have tight muscles, though, you need to try and find a way to relieve the tightness. So in that case, stretching can be good. Getting a massage can be good. Using some kind of massage gun, a Theragun, can be beneficial, particularly if you have damaged muscle that's developed scar tissue, what we call trigger point therapy or myofascial release therapy. So all of these things you have to think about this in sort of a very, I don't like using the term holistic because it's misused, but you've got to look at this in a very holistic way, and it's going to be different for different people, I guess.
What is trigger point therapy?
So trigger point therapy is when you have, it's usually some kind of manipulation, usually done as part of massage therapy. If you have muscles that you've put through a lot of use and abuse, then, and particularly if the muscles are repeatedly damaged, either through injury or through just regular training that's induced some kind of soreness, then you can build up scar tissue in the muscle. Any kind of striated muscle will have the same thing. Skeletal muscle, typically the cardiac muscle, can develop fibrosis as well. That's a much bigger problem. But skeletal muscle, if you start to develop scar tissue, it can sometimes cause pain. It can reduce the contractile properties of the muscles as well. And so this is when you'll be feeling the muscles, your muscles on your back or your chest or even in your leg, and you'll feel kind of little kind of fibrous lumps in the muscle, and these can usually be broken down. This is scar tissue that can be broken down by using your Theragun, by getting a deep tissue massage. And if you've ever had a sports massage, which I'm sure you've had, they're not very pleasant.
They're
quite painful, and they're sort of supposed to be painful because it's getting deep into the fascia and breaking down some of the scar tissue.
It's not the type of thing you're getting at a spa when you go for a Valentine's Day package.
Absolutely not. No, there are no aromatherapy oils going on here. This is very functional, very unpleasant, but ultimately, and you usually can't walk very well the next day, so certainly you can't train for 24 to 48 hours. But in the long term, this is sort of good housekeeping for the muscles if you are prone to that kind of scarring in the muscle.
Okay. So my Theragun is doing something.
Your Theragun is doing something. I don't think it's necessarily critical. I don't think it's something that you have to go out and buy. But if this is how you choose to keep your muscles in good shape, some people like to foam roll. Some people can just massage themselves. Some people like to get regular massages from a therapist. However you want to do it, that's up to you.
Okay, interesting. So stretching and massaging aren't doing the same thing, no?
No, not really.
No, I mean, stretching is an interesting thing because it does something. Again, it's a question of like, what is your question and what is your outcome, right? Is your outcome that I wanted to improve sports performance? Is your outcome I want to prevent disease? Is it or injury? Like, what specifically are you looking for? And, you know, I think Nick alluded to it. It's like you don't want your muscles to be too loose, but you don't want them to be too tight. And so... You know, yes, it's good to be flexible because because you want to avoid injury, right? If you're thinking about avoiding a sprain or all that, you want to have some degree of flexibility so that when you fall, it's not, it's like, the
bigger range of motion, right?
Yeah, bigger range of motion. It's like the sapling that can bend in the wind as opposed to the oak that stands tall and gets broken by a windstorm, right? So you want to have some flexibility there. But again, if you take the general population, is regular stretching going to prevent injury? It's hard to say definitively if that's going to be the case. Maybe for specific people it has a specific thing, and for a lot of people it just makes you feel better, right? It loosens up the muscles and you feel better about it. So again, it's okay to do things if they make you feel good. Is it going to improve sports performance? Is it going to prevent injury? That's a much more equivocal question to ask.
And yeah, I guess that's... When I think about stretching and when I think about massage, they fall into the same bin in my head because both of them...
Because you're working the muscles.
Yes, and both of them I perceive to be decreasing my level of soreness. So it's interesting that they are not... I never really recognized that they weren't doing the same thing, if that makes sense. I'm like, stretching and foam rolling and massage is almost like interchangeable to me because all of them are probably going to make me feel a little bit less sore tomorrow.
Well, I guess it's important for us to just describe what's causing the soreness, right? So anybody, again, I said this earlier, anybody who's ever done a hard training session, they'll know what it feels like to have sore muscles. When this is the case, what you've actually done is introduced very, very small micro tears into the muscle. Now, if you have a major tear, then you get injured and you have to take time off. And if it's really
don't go stretch a torn muscle.
Right.
That's just making things worse.
And if it's really bad, then you might even need a surgery. If you tear a tendon off the bone, for example, that's a major surgery. But when you have just generalized soreness, you have very, very small micro tears in the muscle, and then it causes some kind of inflammation. So this is why the muscles are sore. This is why they're painful, and you get this kind of inflammation that's going on. So we've got to think about the ways that we can actually help the muscle to recover. So we've spoken about things like, ice bathing and cryotherapy and stretching. And compression tights, but actually the main components of recovery are, you've said it already earlier, getting good sleep, because your body recovers and refreshes when you sleep. You get the highest growth hormone spurt, the highest growth hormone release throughout the day occurs when you sleep, and growth hormone, as you would expect, is really important for the growth and maintenance of muscle tissue. Getting your nutrition sorted, particularly getting enough protein. Carbohydrate as well. Carbohydrate is important for muscle recovery.
So what you're saying is I should eat more donuts.
More donuts, more protein. And again, protein doesn't have to be red meat.
Yeah.
Protein can be chicken, and it can be eggs and dairy and non-animal based protein as well.
Plants have protein too.
Plants have protein, nuts and seeds and legumes. All of this is protein. And we need to make sure we're meeting our protein demands. So make sure you understand what your protein needs are. And just getting rest, getting enough rest. These are the three main ways that we can facilitate recovery. If you think about all of the other interventions that we've spoken about, even if they're effective, you might get 2, 3, 4% percentage points in terms of facilitating recovery. But 95, 98% of the recovery that you're going to get will come from rest, sleep, and nutrition. And so those are the big three to focus on.
I got plantar fasciitis when I trained for my first marathon. And so I asked, the doctors, what should I do? And they were like, just stop running. And I was like, no, but what is listen to me, stop running and get out of my office because I have another appointment. And sometimes it just takes a tincture of time.
Yeah.
And that's how you recover recovery means time.
I'm glad that you phrased it like the 95 and 5%. That's a really nice way to put it in perspective for me, because as an athlete, and I'm sure even just as a person existing on social media and consuming content about fitness, there are so many products that I encounter every single day that someone has said has changed their life, has made them able to run 4 marathons every single Monday, Wednesday, Friday. And it's hard sometimes to step back and say, okay, even if this is going to help with my recovery, the percentage that it's going to help is minuscule compared to the things that are going to take time, like sleeping, like making sure you're putting time and effort into planning your nutrition and just resting. I think it's important that to be able to think critically, because it's so easy when there's nice packaging and compression boots look really cool and Theraguns feel really nice, but it's not the end all be all. And doing all these things for your recovery, if you're neglecting those foundational aspects that we talked about, is not going to do anything.
Well, ultimately, look, getting your diet ship shape takes time and effort and thought and consideration
and a personal cook
and research, right? And a personal cook if you're fortunate enough to have one. And getting your sleep sorted means thinking about your sleep hygiene, and getting rest means maybe periodizing your training a little bit more, and that all takes time and effort. Whereas getting some compression tights, you can just throw money at the problem. Buying a supplement, you can throw money at the problem. Sitting in an ice bath is something that takes 10 minutes of unpleasantness, but you feel better that you're doing what you can to facilitate recovery. And we are primed, we are hardwired to do absolutely everything we can to avoid putting time and effort into obtaining long-term health and wellness. But ultimately, those are the things that are going to be most effective.
Well, thank you so much. I can't wait to continue the psychology discussion later, but for now, I feel very well informed about what I should be doing to recover from my hard training sessions. So thanks, guys.
Wonderful. We'll see you next time.
Yeah.
And that's the end of our show. Theme music by Joseph Hackle. You can find him on Bandcamp as Teflon Joe. Illustrations by Luke Willett. To support our show, go to bodyofevidence.ca/about or find us on Patreon. Patrons of our show get a bonus episode each month called Digressions. Our website is bodyofevidence.ca. The Body of Evidence is not affiliated with the McGill Office for Science and Society and is a production of 1254-0851 Canada, Inc. And when trying to decide if a study is good or not, remember the Body of Evidence creed.
A study in mice is not a study in people.
Coincidences are easy, proving causation is hard.
Scientific studies are like movies. Some are just bad.
We can't stop at a single study. We have to look at the
body of evidence.